Thank you. So, as we all know, most of the students right now they want to go to abroad for higher studies, to settle over there in abroad in various countries. So yes, on demand, we requested to the resource person, Mrs. Savita Bhardwaj, right, to present a webinar on career opportunity, for medical laboratory science students in abroad. So, Savita, welcome to you, right, to join and to explore and to give knowledge. You are going to give knowledge to our students, to the pathways how to go abroad and settle over there. And I, in our box, I can see just Jyot has also joined. I welcome just Jyot also because he's also our alumni. Just Jyot, are you there? So because I am very happy. One more student, my alumni, has joined. Just Jyot from USA. So just Jyot, wherever you also wherever you want to give your inputs, you should also give your inputs over here also. So I don't want to talk so much about Savita Bhardwaj. Savita Bhardwaj, this now it is over to you. First, you introduce about yourself, and then you start your lecture. So over to you.
Okay. Thank you so much, sir, for giving me this opportunity to talk about different career options of medical laboratory sciences in abroad. Uh, if I talk about myself, as I can see the names and I remember the people who like are connected still on social media with me, so they already know, but still I would like to talk about academic qualifications. So I have started my career as a like as a diploma student. At that time I started diploma, then I did bachelor's of medical laboratory technology, and then I did masters in clinical biochemistry. So this is my academic background, and the rest I have the experience in teaching. I taught 4 years in lovely professional university, and then afterward I taught in one single college that's just a simple undergraduate students. So that's my career and that's my academic qualification. Right now I am in the United Kingdom working as a uh, biochemist, working in a different diagnostic centers, like they're having a different projects and working over there. So it's not a it's not a, I would not say that it's like a hospital, it's a diagnostic centers plus research project works. So that's my career and that's my background. And thank you so much, sir. Pranav sir also and Gurinder sir. They are, you people already know them. They are my teachers, my colleagues as well, and still we are connected. We are all are like a family. Okay, so I would like to talk about first thing about the importance of this lecture. As Gurinder sir has already mentioned that most of the people are interested to go abroad and want to start their career over there. But the thing is here, it's the why it's important to go abroad and not in India or only abroad. I would say it's a very good career option. Like medical laboratory sciences or medical laboratory technology is not just about in abroad. You can get a different opportunities in India as well. So let's start our lecture. Are you able to see my screen? Are you able to see my screen?
Yes.
Savita, it's perfect.
Yes, ma'am.
Okay, okay. Thank you so much. Okay, so let's start. The first thing is that as I told you about that I've done diploma, then bachelor's, then master's. Now I'm talking about the different opportunities in abroad. The first thing I can see, we have a 99% opportunities in India as well. But the second option we have abroad. So now why in abroad? I mean, what kind of the things you can get here? What kind of the career options you can get here in United Kingdom? Right now I'm in the United Kingdom, but I would like to talk about Canada as well and USA as well. So these three countries I'm talking about today. So first start, who are lab professionals? Like lab professionals are not just uh, I would like medical laboratory technologies are the lab professionals. No. So if you are a clinical scientist, like means you have done clinical masters, your background is in a bachelor's of supposedly in general medical, not in the medical laboratory technologist, but you have done clinical biochemistry or clinical microbiology or any clinical, then again you are the lab professional. You have done diploma in medical laboratory sciences, diploma in biomedical sciences, diploma in a medical laboratory technology. Different names are there, but still we are lab professionals. So these are the different career options. A lab professional doesn't mean just a medical laboratory technology or medical laboratory sciences. You having a master degree, you can get opportunity here. You having a diploma, you can get opportunity here. You having a undergraduate, you still can get an opportunity over here. So first, like I can see on my screen here, medical laboratory assistants. So assistants, the word assistants, like we are assisting somebody who is working or who is a senior in the lab. So lab seniors are basically, we are the lab seniors. That makes a difference between who are lab seniors and who are assistant. So that's the difference is here, but we can get this opportunity as well with our qualification. Next is the biomedical scientist. Now the biomedical scientist, the name, like in India, it's not a very common name, biomedical scientist, because we think that scientist is something like who is doing research, who is are in the PhD person, postdoctorate person. No, the scientist means who are doing experiments in the lab with samples. Any sample, it could be from a patient, it could be not from a patient. So that's a scientist. The scientist, that is a biomedical study. So next is a medical laboratory technologist. So technologist and biomedical scientist, both are same. Both are same. Again, I'm repeating, medical laboratory technologist and biomedical scientist. The both are same. In Canada, medical laboratory technologist word is used for undergraduate person or senior person. In United Kingdom, biomedical scientist is used for a senior person. But the assistant, the person who is assisting the biomedical scientist or medical laboratory technologist, known as medical laboratory assistant. So this is the difference basically. Now next I have added here clinical laboratory scientist. Now it's again a scientist and it's a clinical laboratory. That means a specific clinical lab where the person is only dealing with the diagnostic purpose, like diagnostic things they are doing. Diagnostic means it could be sample, but from a different patients, or from not all the patients are coming to give you sample. It could be research on the human blood sample or human any sample. So that's a clinical laboratory scientist. So now this clinical laboratory scientist is basically for those who are specialist in specific field. Specialist in specific means like in LPU or in your university, you can see you are doing clinical biochemistry or clinical microbiology or clinical embryology or clinical any subject that is the specific to that. So this lab, basically, this clinical laboratory scientist profession is for those who are specialists in a specific field, right? So these are the different career options available in different countries like United Kingdom, Canada, and USA. So now I will talk about different qualifications, because I can see the people over here, there are some are the master students, some are diploma students and undergraduate students. The question which comes in our mind, I'm diploma students, what can I do? Like I have a diploma, and now I want to go to Canada, what I can do with my diploma? I want to go United Kingdom, I have just diploma, what I can do? Or I am undergraduate student, I have done 3 years bachelor's or 4 years or lateral entry with diploma, what can I do? So that's the thing I would like to talk about here. Or the master students as well. So see here, the different opportunities available. As I mentioned, the names are here. With qualification, you can grab every opportunity. It doesn't mean you can't work, you having a degree and you can't work as assistant. You can start your career as an assistant. You have a diploma, you can work as an assistant, and that assistant is not only here in India as well. The thing that which differentiate the Indian assistant and here assistant is just your experience. You are doing in a very simple basic lab, and one person is working in a good hospital, reputed hospital, like we have like Fortis hospital, or there are a lot of hospitals, good hospitals I'm talking. So you, one person is working there and one person is working in a simple diagnostic lab where you are collecting 5, 10, maximum 20, 50 samples. So that's the difference. With 20 samples, what you will learn, or what will you learn there? Earn and learn, you know that better. And if you are working in a hospital, you are in that environment, you having a number of things over there, so you just grab every opportunity that is coming to you. Opportunity is not like that is coming to you, you have to find out the opportunity with your qualification. So it depends upon your mindset. So like as I said, diploma, undergraduate, masters. So now what's the difference? If diploma person is saying I have just diploma, but I have to study, or I can work, or undergraduate student, these two mindsets are very important. Undergraduate students always like plan their undergraduate, I will do undergraduate and then will work. Diploma students think I will do diploma and then will work. Master students as well, they, because they're having undergraduate and now they are doing masters, and they think I will do masters and then will start my career, or I will go for higher study. So these are the different mindsets are like we have in, or like as I mentioned, in audience we have a different people here and different with their different mindset. So that mindset is very important. That's really matters when you want to go somewhere or when you want to start your career. So what is the mindset matters, what is that basically? Now I'll give you example here. If diploma students say I want to study, because I think diploma is not sufficient for me, I have to study for my career, I have to do bachelor's in the same field. One thing. Second thing is a job, I want to do job. Now job person will be undergraduate student. If I'll take example of undergraduate, so bachelor's of, after this your bachelor's BSc, you will think about now the job, I want to do job. Now both mindsets are correct at the same place. At the same place means now after diploma you want to do graduation, and after graduation you want to do your um, job or study. So that's the two options available. But now the thing is here that actually the problem is there. The people who are doing diploma, they think that they should move to Canada for study, or not for only Canada, like they are planning to do go for like Australia, Canada, United Kingdom. So there are lots of like people and lots of things are there, like I want to go abroad, I want to do study, मुझे तो abroad ही जाना है, मुझे तो पढ़ना है, मुझे career set करना है. Like these are the things are over there. But do you know that the expense of this study? You want to do study, but do you know the exact expense of the study? If you want to go Canada, you can go, you having money, but how much you are spending? How much? Like 15 lakhs, 20 lakhs. There's not less than 15 lakhs. There's not less than 15 lakhs in any country. So 15 lakhs, do you, I mean, can you think about 15 lakhs at this moment? Your parents is earning, like they're having money, but 15 lakhs is just a waste of money. I would say that's a waste of money, because you having a good option. You are in that field, like the, you are not in the other field that you need to go abroad. You are in that field, you can get opportunity from your own country. I have a lot of people in my list here in this country. They tried from the India and now they are settled here in the government hospital. You think like it's not an impossible thing, you know. It's not impossible thing, it is possible thing. It takes time, it takes patience, it takes many things, but it is not like that I want to go Canada, le lo course, koi bhi course le lo, any course you want to take, chemical technology, there are a lot of things. But you know, that's not the thing that you want to do, because when you, like when you enter in that thing, you think, oh, I have done this thing, now I want to do in my profession, I want to do a job in my profession. I don't want to work, like I don't want to work in the KFC, I don't want like to work in the different, that's the part-time things. Part-time things you can do just for 2 years, 3 years, 4 years, but at one stage, at one time, you will think, no, if I have done diploma, if I have done undergraduation, or if I have a master's, why should I work in the KFC, or why should I work in the, like in the other area which is not relevant to my field? So that means you are really, you having that I mean, that kind of the enthusiasm inside that you will start or you want to start your career as a medical laboratory scientist or medical laboratory assistant. And then, then what you think, kash hame koi mil jaye, like somebody who can help me to get this opportunity in Canada or in UK or wherever you are, right? So that's the study I would not prefer to. You go to move abroad and just do any course and then just do the things that is not relevant to you, and your soul will not allow to do the other things. I am telling you, your soul will never will say that you just do this thing because you have not, that's the thing is very important for everybody. So now next option is the job. Now if I say you are doing undergraduate in your country in India, and you when you complete, you just need to be patient. You just need to understand the things, how can I get opportunity from India as well as from abroad, like how can I get opportunity. Now undergraduation basically 3 years you are doing, or with diploma 2 years you are doing. Now the thing is here, that's very important thing. Now that I will talk about that job, how you can get opportunity, the entire 40 minutes or 60 minutes timing we have, I will talk about that, how you can get that job opportunity there. So this study that you are taking from abroad, that's very expensive, that's very stressful, that's not at all easy. That's not at all easy means you have to spend money. After spending money, you will not get job in your profession. And the third thing is here, you will be in the stress because you are not doing the same work that for you are studying or you have studied. So that's I will not say. Now that's the study is not no, just no, because now you are in the India, you're having a very good options for other things. Now see, new job just ahead. Just ahead means you are doing diploma, you just need to do undergraduate, or if you are in undergraduate, you just need to do masters in a specialist field. Because Canada, America, or UK, they having a I would specifically will talk about Canada and UK. They having a shortage of occupations. Shortage of occupations. Basically, the top one list in the list, the top name of the shortage occupation in the UK is the biomedical scientist, biomedical technician, biomedical, whatever the name you say, lab technician, laboratory technician, biomedical scientist, medical laboratory assistant, medical laboratory technologist. They are in the shortage of occupation in UK, and the same in Canada as well. The shortage of occupation, if you know, if you having any idea about that labor marketing or the skilled work visa in the United Kingdom or in the Canada, this is the shortage occupation. And you people are doing masters, you are doing undergraduate, you just need to process yourself for that thing, not for just to take a loan or to take a money and just go and take a course, any course which is not relevant. And because it's a mindset, you're having already a created your things in the mind, I will go there, will take any course, will do that, and then no, that's not possible. That's not possible thing. That's very stressful thing, very expensive thing. Because you're having a good option, you're having a good degree, and that degree really matters here in the United Kingdom, in the Canada as well. So now I will talk about United Kingdom. See, as I mentioned, different options here: biomedical laboratory scientist, medical laboratory scientist, clinical scientist, assistant. There is a difference basically. Basically, what's the difference? How you can get that opportunity here? See, you should be prepared in advance. Like you are doing, supposedly you are in the third year of your bachelor's, right? So you are in the third year, you are going to almost your study, like or internship, or your whatever the semester you are. So you should be prepared in advance. You have to plan accordingly to that, right? So medical laboratory assistant and biomedical laboratory scientist, they are the difference basically. Basically, what's the difference? Difference is basically that registration, or you can say it's a license, kind of a license. You like, we are a healthcare workers, you understand? Healthcare workers, what do you understand by healthcare workers? Can anybody talk? Because I am feeling like I'm talking just with my screen. Can anybody talk?
Yes, ma'am. Healthcare workers are the kind of workers that are into the health sector.
Health sector, what do you mean by health sector?
that is any kind of sector that deals with the treatment of or a kind of that take care of the human
Yes.
treatment or yeah.
Exactly, the take care of the human. And human mean like we people, the people, like we are doing the things with people sample. So that's the very important thing. Healthcare is not just like you can do anything with patient sample or person sample or people sample. You should take consent from them to do the experiment with their samples. So it's not like that. It's, see, there's the rules and regulations everywhere. It's different. In India it's different, or in African country it's different, in UK, US it's very different. So we people are not allowed to do anything like means I'm taking sample and doing test. We are not allowed to do that thing, because it's not we are people. It's not like a animal. In still, animal cruelty is not a good thing, but it's kind of, it's not allowed. So in India we don't have any registration or any kind of regulatory bodies which can control these kind of the activities. But in United Kingdom, or in America, or in Canada, or in Australia as well, they're having a one regulatory body, you can say, or professional body who controls all the activities of this, right? So in United Kingdom, the regulatory body is HCPC. It's Healthcare Professional Council. HCPC, Healthcare Professional Council. So that councils who having a standard rules and regulations for everybody who is working in healthcare. They're having a different rules. Like for biomedical scientists, they're having a different rule. For doctors, they have a different. For radiologists, they're having a different. For physiotherapy, so it's a different kind of the rules for everybody, not for just a single person. So that's the thing is here. Now that opportunity, how to now enter in this field, like want to become a biomedical scientist, but now how to enter in this field. So as I mentioned, without that council, without that consent, or without that license, like you're not allowed to drive on road without license. So similarly here, we are not allowed to do anything in the diagnostic center without that regulatory body or professional body. So that SCPC is very important here. People can work still. See, it's not like I don't have SCPC, but what should I do without that? I can work or not? I still, you can work, but there is another rules, right? So there is another rules. So now how to process for that? Because that registration is very, very, very important here. Without that registration, you can't. As I said, you are not allowed to do the things with that. So now see, the step one is education assessment. You are in India, you are doing diploma or masters or bachelors over there. Now let me explain the one thing here. The education system assessment means somebody is doing their undergraduation or masters in India, and somebody is doing in United Kingdom, America, or in Canada. So now what's the difference? Do you think it's the same? The years are same, or the syllabus is the same, or the things that evaluation parameters are the same? What do you think? Can anybody talk about it? What do you think? Do you think it's the same or different? Can anybody tell me? Do you think the education system of any country, you can take example of your country, India, it's the same with this country or Canada or America, any country? Do you think it's the same?
No, ma'am,
There
it's
might be
different.
some slight differences
It's a difference.
among the
In the
educational system, yes.
Yes. So, okay, I can see in the chat box people are giving answer over there, right? So, no, ma'am, no, it's not. It's different. It's like the standards are same. Okay. So, in what parameters do you think it's not the same? What parameters? I mean, see, it's very easy to say from there, like it's not same, but why? I mean, what do you think? What kind of the parameters are not same?
Like in terms of the scheme and the curriculums also.
Curriculum, okay. So schemes and curriculum, yes. What else?
At
What
times
else?
the duration differs also. The time
During.
duration.
Yeah. What else?
Syllabus, subject, etc.
Curriculum. Yeah. Syllabus, curriculum, both are the same. Scheme, curriculum, duration. What else? What do you think? What should be the other thing? Okay, right. So evaluation parameters as well. Okay, Umang. Okay, evaluation parameters as well. Yeah. So you know already that thing. See, duration is very important. That's very important. I'll give example here. You Nigeria country. So Nigeria, it's a totally different from UK, US, or from other country. They people do 5 years of bachelors of medical laboratory sciences or biomedical sciences. The name is different. So what they are doing in 5 years there, you know what they are doing in 5 years, you are doing in India 3 years or 4 years. So that's the difference, the duration. The second thing is here. Okay, so duration is different. Now the assessment, how that assessment is different. Assessment, see, whatever the degree you are doing, you have to give for I mean, you need to do examination, and then you need to do for practicals. So these are the examination, the practicals are very important. That's everybody, like everyone, every country, they are doing same evaluation parameter. They're just a little bit difference, but the duration is very, very important. Duration means, I'm not saying that 5 years is good or 3 years not good or 2 years not good. No. So that's the thing we need to understand. Like in this country, in the UK, they're having a 4 years, and in the other countries also the 4 years. But some degrees means the medical laboratory technologists are 3 years. So that's the thing, they need to assess, and it is very important to assess. It doesn't mean that you are not eligible, you don't have that kind of the thing. So that's the education assessment means. Evaluation parameters are different, education is totally different, but it's the same field. It's the same field. You're also studying anatomy and physiology, hematology, microbiology, your biochemistry, blood bank, blood sciences, clinical part. So same everywhere. In Nigeria, they are also doing the same thing. In United Kingdom, they are also doing the same thing. In India, they are doing the same thing. They just need to check that thing. Understand? Means they just need to check that thing कि क्या वही same or the same things they are doing in India as well or not. So that's the education assessment part. Second is the registration. So registration means, see, this education assessment for Canada and for America, you have to assess your education. Why? The website is World Education System. WES assess. It is known as WES assess. They assess the degrees. I'll show later how they assess the degrees there. So in this country, they said the UK NARIC. UK NARIC, NARIC, NARIC. But you know, the best thing for us means only for Indians. The best thing is that we do not need to go for UK NARIC, because our education system and UK education system is 99% same. 99% same means we having a 12th standard till 12th standard, and then we go college after 12th, and then we do graduation, and then we do masters. So that all the same system is over here. They did, I mean, the people are also doing the same thing. They're having a graduation, they're having a master's degree, we having the same credits as well. The credits are very important. The 5 years bachelor's means the credits are very high. 3 years bachelor's, the credits are very less. So that's the difference. It's not a kind of that they are doing something else. They are doing physics or chemistry or the other thing. It's the same thing. So that after that, the registration. Now registration is very important. Now the registration, what's the benefit of this registration? The benefit is here. You are doing anywhere, any country, anywhere, you're having an undergraduate degree you have. Now what you can do with your registration here, if you get that SCPC registration, you will be allowed to work here as a biomedical scientist. I'm again repeating, if you're having a registration of that, you will be allowed to work here as a biomedical scientist. And you can get that job from your own country, because they have in this country, there's a shortage of this occupation. They're having a very less number of healthcare professionals here. They need physiotherapists, they need biomedical scientists, they need doctors, they need doctor assistants. They are in a shortage. So these two countries having a shortage of these things. And the first in the list, the first top name of is a healthcare worker is a biomedical scientist, or you can say medical laboratory technician or technologist. So that's the registration. You can get that registration and you can get job. Now one option I discussed here, you are going to abroad for study and you have to spend 15 lakhs or more than 15, not 15 lakhs is just a minimum amount and very rare. It's always 20 lakhs above. So one option you have that. The other option is here registration. You just get the registration. Registration is cost around 50,000 in Indian currency, 50,000 in Indian currency, or 495 pound in UK currency. So that's the difference. You having two options. You want to go there. You just to you should be having a more than 20 lakhs, and one is just a 50,000. If you're having a 50,000, which option you will choose? Now let's see. You have to talk now. Which option you will choose?
50,000, man.
50,000. 50,000. Anybody?
And what about the chances?
Chances are 100%. 50,000.
50,000.
Everybody is like, see, everybody is allowed to say, everybody is allowed to raise question, raise hand. I can see the Phoebe has raised the hand. Phoebe, you can say if I'm pronouncing your name. Okay. 50,000, 50,000. Exactly. So see, you having a one option is to spend a huge amount of money. The other option is just a 50,000. You understand? Now what you can do for that?
Ma'am, what about Canada? You are telling about
Canada. We'll talk one by one. I'm having added the detail of the Canada in the next slides. We'll talk about that. Okay, how we can go for registration? Yeah, we'll talk about that registration. Don't worry, we'll talk about that. But anybody else, they think that we should go for the course, should take a course and should do the course 2 years, maybe 1 year. Fir kya karoge after 1 year? You will work as a labor. Or you have to work for the registration. You understand my point? If you do course, you again have to work for registration. Because I told you one thing in beginning, your soul will not allow to work in a KFC or in other things. I'm not saying that job is not good. That job is also good. But for you people, do you think it's good? You can see you are in a, I mean, your demand is very high, but if still you are doing work in the warehouses or in the other things, that's not relevant to you, but still you will not allow yourself to do that thing. So definitely you have to work for the registration. You will think about that. But 2 years or 3 years, if you take a course, that's a spend, you're wasting your money and time as well. Right. So how we can go for that? What about qualifications? Qualifications. See, I discussed already. Again, I'm telling. The thing is here, undergraduation you are doing, right? In India, let's talk about just in India. 3 years you have done undergraduation, and then you are doing masters. If I say masters, so masters definitely you will do in a specific field like biochemistry, like I did in biochemistry, clinical biochemistry. And if you do in the microbiology, so microbiology. So it makes a 5 years, 3 years your BSc and 2 years of your masters. The total will be the 5 years, right? So this is one option. If you having just a diploma and degree, you understand my point. You having a just diploma and degree. Now you will be, as I mentioned, in the United Kingdom, again, this is very important. The education is almost same. Education is 99% same. Means if you do diploma in your country, in India, that is also diploma here. And if you do bachelor's over there, that is also bachelor's here. And for that biomedical position, you should be having, you should be undergraduate, not diploma. You should be undergraduate. Diploma is it's like from India, you want to come here, then diploma is not sufficient, right? Because diploma is everywhere. If you want to work in Canada as well, their diploma is not that kind of the thing you are easily getting the job. You can work it's not like that you can't work in the lab. You can work, but if I'm talk about the visa, you need a visa. You need to settle down. You need a work visa. You need a skilled visa. That is known as skilled visa. So that visa you need. So for that, you should be undergraduate. You understand? So you should be undergraduate. You should be as per their criteria, because visa and the healthcare, that's the criteria are different. So the qualification, if you're having a master degree, you're still eligible. You are still eligible. If you're having a abroad, if they can get opportunity by spending registration charges, why people choose education in abroad if they can? That's the thing I'm talking. If they can get opportunity, why they are wasting the money? That's the thing I'm saying. And it's, see, yeah, Jeevan, your question is the lecture, actually. That's the lecture. If they can get just opportunity with just this registration, so why they are wasting the money? You mean to say that? And that's the lecture. That's the lecture. Now, what's the thing we need to do? We need to just process our uh, educations or the things for the next job. Let me show you one thing. Okay, so registration is the SCPC registration. The next is the job search. Now, job search, I will show you everything. I will show you here. So this is, I was talking about UK NARIC. UK NARIC is not mandatory because it's almost same system, but you can see the qualification you have done, and that's it's just example I'm giving. It's just example I took from internet. It's not my question, because I already know that I'm masters in India, I'm masters over here also. So that's not the thing. So this is the level here only. RQF 3 level, 6 level, 7 level. 7 level is the masters here, and 7 level the masters is in India. So that's the equivalency here. That's not the big issue, right? So this is the registration way, the SCPC. If you log in over there, you can see there will be the international route, national route different, and international route different, and the requirement for the registration. That's the point. Education assessment ho gaya, education assess kar di. No need to go for the education assessment. You just need to collect your documents. Aapne kya padha? The syllabus you have studied. You have the syllabus, and what you call that, evaluation parameters, and it is written on your syllabus. Like it's a this is the credit, and this is the evaluation parameter, like it's a examination, practical, or the practical course will be written practical, the theory course will be written theory T, and same way. So that's the thing you need from your university. Wherever you are doing, you need that thing from your university. That university will provide you everything, because it's not you are providing syllabus. No, that should be proper from university, stamp and sealed from your university. One thing. Second thing is non-native countries IELTS required. Yes, IELTS absolutely required. Though we are most English speakers we are in the world, but still we have to show our proficiency in English language. That's the important thing. And non-native countries, we are still non-native countries. We are not English speaking countries. So that's the thing, we have to show IELTS, and with no element below 6.5, means 7 overall you need, and no less than that. See, you want to move in English speaking country, and how can you expect they will not ask you about your English? You understand? आप English speaking country में जा रहे हो, you want to go there, you want to work there, you want a skilled visa, and they will not ask you. They will ask you. So that's the important. They will ask you. They need a proof of your proficiency. And then professional experience. Professional experience, I would say, not important. Not important, not mandatory, but if you have, that's very a plus point. That's very a plus point. So, आपने undergraduation किया, supposedly if you do your undergraduation in this year, you just process yourself for this registration. If you get this registration, now what I can do with registration? You have to apply for job, because यहाँ पे the government website, they will not allow to apply for this job without SCPC registration. Right? And references is very, very, very important. References means kya references samajhte hum? You are doing bachelors, you are doing masters, you are a student. You have to provide your academic reference. Academic reference means from your HOD, from your head, or from your teacher, or from your anybody that who is who knows you in your academic profession. And anybody means not your friends, your academic person, your tutor, your lecturer, your professors. They will provide you that reference, and without reference you can't do anything in this country, not in Canada as well, in the other things. The references are very important, and professional references as well. Professional references means ki आप हॉस्पिटल में जॉब कर रहे हो, यू आर वर्किंग इन अ हॉस्पिटल, यू आर वर्किंग इन अ लैब, यू आर वर्किंग इन अ गवर्नमेंट, यू आर वर्किंग इन अ प्राइवेट, एवरीवेयर, कहीं पे भी आप काम कर रहे हो, यू नीड अ प्रोफेशनल रेफरेंसेस एज वेल, मींस योर सीनियर पर्सन जिसके अंडर आप काम कर रहे हो, यू आर वर्किंग अंडर somebody is your senior, somebody is your lab manager, supervisor or whatever, superintendent कहो उसको, senior person. So that's the professional references. You have to show that. You have to show, yeah, you, because they ask. And it's not like that you are writing something and you are saying ye mera references hai, I got it from my tutor, I got it from my professional boss or superintendent, and you are providing. No, that's big no, because it's a transparent system. You just need to provide their professional IDs. Professional IDs, you understand, like aapke jo teacher hai, like in LPU, प्रणव सर एग्जाम्पल लेती हूँ, प्रणव सर की आईडी, ईमेल आईडी है प्रणव डॉट whatever the unique ID, and then lpu.co.in, that's the business professional ID. If you work in any hospital, har ek hospital, everywhere they're having a professional ID. It's not like gmail.com, yahoo.com. That's not a professional ID. That's not a professional references. They don't select, nobody select that kind of the thing. That's because maybe it is a fake document you are providing. So you should be always touch with your academic tutors, teachers every time. It's not like aapne diploma kiya, now bye tata, I don't want to talk with you, I don't want any need, I don't know. So that's the thing, is not that's it's not just for a career. Oh, that's not a good thing. Other thing is professional. Supposedly आप job कर रहे हो, working in a hospital, and again the same kind of the thing you are doing there. No, I don't like him, I don't like her, she's like kind of that, he's kind of that, मेरी नहीं जमती इससे, I don't want to work here, I just want to move somebody like somewhere, or I don't. That's not thing again. You have to bear the things. ठीक है? Not always we can't move in life. You understand my point? We can't move in life with our, like, without our past. We have to move with past, and the past means कि आपने job छोड़ दे, that was my past, I don't want them again in my life. मैंने बस reference what you call that experience letter ले लिया, now I got my experience letter, I don't need. No, experience letter, nobody will talk about that. I have experience, I have teaching experience, I have other experience, but nobody will talk about that experience. The experience is you, what you learn, what you have, the thing direct they ask them. So references are very, very, very important, not only for registration, for job purpose as well. Okay, and the fee is just 4,954.95 pound. Now this is the, I was talking about key how you can get that things from your university to assess your education. You can see here, you just need to fill this. I mean, not you, your HOD or your teacher, those who are in the department, they will fill it for you, right? And agar aapne unse bagaad ke rakhi hai, I don't want them, I don't want anything, they will not do. Definitely they will not, but still they are very, you are student, they are not student, but see the name of the applicant, the name of the institution address, institution email, institution telephone number, title of professional courses, supposedly have done bachelors of medical laboratory sciences, and title, after the title, date course commenced, the date of the course you have started. Supposedly if I say August 20,000, like 2013 or 2017 or 19, so date course completed ho gaya. Now the next is the very important year course, like 2-year course, 3-year course, 4-year course. That's the thing. Subject descriptive title, whatever the subjects you have studied. You have studied clinical hematology or clinical biochemistry or medical micro, whatever the subjects, subject 1, 2, 3. Now you are studying, I think 7 or 8 subjects per semester, 5 or 6 or 4, so whatever. So that you need to explain there. And what are the topics were there? Kya topics the? If you have studied hematology, you are doing CBC, you are doing other coagulation studies, you are doing the other things. So that should be mentioned here. Now what are the assessment method? You can see here the assessment method: verbal, written, practical. You are doing practical. That's the education assessment. You can't say hum eligible nahi hai, what's the qualification? That's the qualification. You are doing verbal, you are doing written, you are doing practical. Yes, and undertaken all the subjects you are undertaking at your university or institution. Yes or no. No means you are doing internship. Where you are doing internship in your hospitals. The hospitals at that time it will be no, but the evaluation is done under university or whatever the things are there. So these kind of the thing you need to submit them. One, आपने ये submit करना है. Second is your syllabus copies. If you can see here, name of the applicant, a curriculum certificating document may be submitted. So sorry, that certificating document means syllabus of all the subjects that you have mentioned here under 1 2 3 in these boxes. So same copies you have to submit with stamp, sealed properly. So institute ki stamp and seal hoga, right? So this is the one thing. Second thing, you have to submit your degrees as well, transcripts as well. Transcript means DMC hogi, degree hogi, this form, right? So these are the, and proof of the English languages. Proof of the English language is IELTS. IELTS could be general IELTS, it could be academic IELTS. For this country they just need a IELTS, that's it. And another interesting thing I would like to talk about IELTS. People can also apply without IELTS. They can also apply without IELTS also. That's the different procedure. How we can apply without IELTS, that one I will not talk about. I will talk later if we'll get the time, right? But at the moment we need IELTS for that, right? Now next thing, okay, mujhe registration mil gaya, right? Registration, I got my registration. Now what we should do now next? Can anybody tell me? I will answer all the questions, chat box. Later on, I will answer all the questions. Can anybody tell me, if you get your registration now, you got your registration. Now what do you think, what should be the next thing?
Ma'am, we have to apply to different companies online from our country.
Apply for job. Okay.
Yes, ma'am.
You will apply for job. Okay. Now next thing is, yes, we have to apply for job. Now how will apply for job? Can anybody tell me how will apply? What you think, how to apply? I mean, like in India, the government job jab nikalta hai, like the government job advertisement, you just take the form from that and then you just fill either online or offline. But what do you think, how we should apply for this? Like if I'll talk about Canada, ab Canada ka bhi pucha tha kisi ne. Somebody has asked about the Canada. I will talk about Canada also. But first you tell me, what do you think, how you can apply for job? Like for Canada, from India for Canada, or from India for UK. What do you think? How?
I think, ma'am, it may be due to through some of the agencies, or directly towards their website or something like that.
Right. So either we can take help from the agencies or we can go direct. These two options. But what do you think, like job portals? Okay, so job portals, what kind of the job portals? Like if you open Google, there are lots of websites. Do you think they all are authenticated or valid? Do you think they're all websites that you're applying? Like if I say shine.com, that's very most common in India. Do you think they're all kind of the job agencies or job websites that are valid or authenticated?
No,
What do you
ma'am.
think?
No, ma'am. I think
No.
LinkedIn is good.
You think LinkedIn is good? Okay. And what about other website? How you can say these are not good or these are maybe authenticated? What do you think?
Ma'am, for Canada, it is Kijiji website for applying for jobs.
Okay. For Canada. Okay. Okay, right. So the first thing is I can see Abu Bakr. He said that we can take help from agencies or we can go for direct. Now I am in India, but I don't know about the agencies. What are the agencies there? How can I approach them and how can they apply for me? Maybe they will ask for money, because most of them say you just register here 5,000, 6,000, 10,000, 2,000, register yourself and we will help you. No, you understand? That's not a good thing. Like we can't trust anybody that somebody is taking money for registration and saying you can help. No, this is all the things I have discussed here is the self thing. You're not taking anybody's help here. You people are graduated, or you all are studying, and you all are student. You can understand the things on the websites. So these SCPC registration is not a private agency or not a private thing. It's a government website. You just log in there, you just see the things, you can read the things, you having their documents, you can, all the things you can get from that. So now the job search is the best is this time way is the LinkedIn. The best is the LinkedIn. You have, I hope you all are on LinkedIn account. You can make a professional account, professional ID, professional thing, and absolutely no fake thing over there. No fake thing means like somebody is writing something else which is not relevant. मैं पता नहीं क्या कर रहा हूँ और लिख कुछ रहा हूँ. Right, I'm not a doctor, but still writing on LinkedIn I'm a doctor. That's the very important thing. So you just create your profile, but should be relevant, should be absolutely transparent. Like somebody, if I'm sitting over here, I want somebody who is should be like can be part of my project. I can approach you, but if you having all the things relevant in your LinkedIn account, definitely I will choose you. So that's the very important thing. LinkedIn, Indeed is also a good option, because Indeed is worldwide, not only in the UK, not only in the India. Indeed is also best option to search job for Canada, for UK, for other things also, right? And the government websites, the most important are the government websites. Government websites are the very important things. So these are the websites I have added for you people here. The first one is, you can see www.ac.uk. That means that's not a kind of that ID. UK, AC UK is always a government website. You just click over here, you will see the detail. Here you can search the studentship, studentship research assistant. You, after masters, you want to become a research assistant, you can apply for that. You can apply. You are doing microbiology. यहाँ पे microbiology, they need a microbiology people as a research associate or research assistant. As a PhD studentship, you can also say for that. But after masters, you can search over there. You can search your jobs on this website. And this is the jobs new scientist for anywhere. For anywhere means not only in the UK, anywhere in the world you can get job by this link, jobs.newscientist.com. Careers. So these all are, there are a lot of things. These are not the private, these are the websites where you can search your profile, and you can make a profile, and then you can start your process. Now I will talk about here. Next is this one is, you can see example. It's visible. Screen is visible. My screen is visible.
Yeah.
Yes, ma'am.
Thank you. Okay, so this is, you can see the healthcare jobs in the UK. This is basically your World Healthcare is the agency. The Abu Bakr, he has mentioned that private agencies we can. So this is private agency means we are not paying for them. I have registered here. Many people have registered here, but that's not for the payment you are doing. No, it's not. It's not for that. This is just healthcare worker. This is the agency. You have to submit your CV, your education, all the things on this website, and you can search from there. They can help you in that. This is one example I'm giving. Then there is a Aerotech also. Aerotech also, they also help in the same way. There are lots of, but the best way is LinkedIn. Always remember, the best way to get job is LinkedIn or government website. Now let me show you one thing. If I can, if you can see my entire screen. Are you able to see this screen, entire screen?
Yes, ma'am.
Its PPT is visible. Your PPT is visible.
Only PPT?
Yes.
Can I share my entire screen?
PPT you can drop down and pull it down. Yes, you can minimize it, then it will be visible, I think.
Okay, so it's visible?
No.
No, it's not visible.
It's stuck, I think.
Now visible?
No, your
No,
PPT
still
has
not visible.
stuck, I think. You can maximize your PPT and then you can try it. Now you try to.
Okay,
No,
nothing.
it's stuck in between.
Let me take the screenshot. Let me add. Okay, now it's visible. Something.
Yes.
Okay, so see, this is the NHS website in this country. This is the NHS website. NHS is the the national health system here. The simple and shortcut, I would say. Now I will not explain all the things in detail, but the simple and shortcut, you having a SCPC registration, aapko registration mil gaya. The next thing is you have to create your profile. Here you can see my name, the profile, my applications. You will click on these things. Here you will search the jobs. See, biomedical scientist, special scientist, biomedical scientist. So this is one example I'm giving. Let me take the other thing because I'm not able to share this thing, but let me show you one thing. Search job. If you will enter here, search job, biomedical scientist, type the biomedical scientist, and okay, so this is the thing. All right, so here you can see biomedical scientist. I have searched a position, right? I have a registration le liya maine from India. I got in India, you are in India and you got this registration and you are in India. Now you want to apply for the job. So LinkedIn is a good best option, but the second option is the government website. So this is the government website, NHS, National Health System. Here you can apply for biomedical scientist, for doctor, for radiologist, for anywhere, anybody that who's working in healthcare system. So this is I want to apply. See, you can see biomedical scientist, biomedical scientist, but this is the first one is public health in England. Second is the name of the trust, hospital name. So that's the area name and the trust hospital. And the next is again the area name and NHS Foundation Hospital. They need administration, they need hematology, they need medical microbiology. So in this way, there's a huge list. Sorry, I'm not able to show you the entire screen. Otherwise, I can show you the things how to apply. So here you can see the salary range. Now the salary range, let me tell you the one thing. Before to apply anywhere, you just need to understand the requirement of the job. Here you the second option lete hain, second option here. The biochemistry section of this trust hospital is looking and appoint a suitable qualified, experienced and SCPC registered biomedical scientist. One thing. If you read the third, again, highly motivated SCPC registered biomedical scientist, clinical microbiology. You can see the Department of Clinical Microbiology. So if you are doing masters in clinical microbiology and if you're having SCPC registration, why would not you be able to apply for this? I mean, who can stop you to apply for this? Who can stop you to not apply for this? Nobody can say you're not eligible. You understand my point? आपको रोकने वाला कोई नहीं है. Nobody will stop you to apply for this. Nobody will say you're not eligible. That's the thing inside. If you are saying, oh, मुझे job कैसे मिलेगा, मैं क्या करूं? You have applied for this. See, I'll take example of this medical microbiology. Here the salary range you can see 10 to 20,000, 20,000 to 30,000, 30,000 to 40,000. So see, as you are a fresher, you're not an experienced person, or if you have experience, but I'll take example of fresher student, right? So you are a fresher. So you should select 20 to 30 range. Right, 20 to 30 range. Here you can see the 50 and 66 numbers. Maximum देखो ये vacancy कितनी निकली है. You can see 50, 60 every time. Whenever whenever I open this website, there are a lot of things, and you can connect your account with this website on LinkedIn also. Whenever they open the vacancy, you will receive a message in your LinkedIn. There is the vacancy in this particular area, in this particular hospital. You just need to fill that. Okay, in LinkedIn पे क्या होगा, you will get messages all the times, there is a vacancy in England or in Cambridge or in, I mean, the locations you will fill over there, right? So we should select these two, either the first one, 10 to 20, 20 to 30, 30 to 40. So for these we are eligible. Ab difference kya hai? Supposedly you want to apply as after diploma, okay, or after this after diploma, but you don't have SCPC registration, I would say don't apply. You know, the thing is that people around the world, there are a lot of students, lot of things, they are doing bachelors and they are doing masters as well. Diploma ka chances kya ho jayega, little bit less comparatively the other. But if you're having a undergraduate and if you're specialized, see, specialized means ki you're having a bachelor's and you having a MSc and clinical microbiology mein, or you can see the position hematology, everybody can apply. Medical microbiology, only you can apply if you're having a master's in medical microbiology, sorry, I mean the clinical microbiology. See, medical or clinical, there is no difference, no difference at all here. Medical microbiology something is else, no, or clinical microbiology something else, no, it's same thing. लिखा उन्होंने medical microbiology, here you can see, but here is लिखा the opportunity has arisen with the department of clinical microbiology. See, it's the same thing. That's not a big deal कि मुझे medical micro में ही जाना है, I want to do medical degree. You know, when I was there, I thought I should do I should have done medical biochemistry, but no, I was wrong because the thing that I have seen here, it's not a different thing, it's the same thing. You can see over, you're having an example here, you can log in yourself if you having a, like, you think I want to validate the things are there. So that thing, yahan pe apne salary ranges you can select. The second thing is the bands. Now, what kind of the band? Now I will explain your experience here. You are with the bachelors, with masters, you can go for band 5. Band 5, okay, band 5 is the starting thing, and band 3 to 4 can do without SCPC registration. You don't have registration. Abhi mere paas sare examples wahi hai. I have all the examples or students who don't have SCPC registration. They still can apply for band 2, band 3, band 4. You understand? But see the number of the vacancies here. Number of the vacancies for band 2 4, for band 3 1, for band 4 8, means very less. You understand? Means if you're having a diploma, they need very less number of people. But if you're having a degree or you're having a specialist degree, you can apply for band 5 and 6 for both. Now difference kya hai? Both the difference, what's the bands difference over here? Band 5 people, the salary starts from 25,000 to 30,000. Band 6 people can earn 30,000 to 40,000. Right? Pound. These all are in the currencies in the pound. So that's the difference. Like if I start my career as, I'm going to start my career as a biomedical scientist, band 5. Right? So now I will work there, and after 1 year or 2 year, the hospital or the organization will help me to get band 6 level. वो क्या करेंगे? I have to do one course. They will help me. I do not need to pay for that. You know, the best benefit of these countries are you are free here. You are free means their hospital is going to apply for you for visa. In fact, you're not paying for visa. And if you're married, right? If you're married, your spouse can come with you free of cost. And your health insurance will be free because you are a health worker. Your family, if you're having a child, if you're having a spouse, so they will be free of cost here. You understand my point? So that's the good thing. But aapko karna kya hai? What you need to do if you are bachelors, if you're masters, best thing pata kya hai? The best thing is do masters. I would say do masters because you are in a specialist in that particular microbiology or clinical biochemistry. That's the thing. Hematology, I'm not saying them do masters in that. For that you need experience. That's all. Right? So these are the bands you can apply. You can come here, and in fact the hospital will apply for your visa and they will provide you. I will show another screenshot if I will be able to see. They actually, when they advertise the post on the website here, and they write the one thing with the advertisement, they need a person who is a tier 2. They always mention tier 2 sponsorship. Let me show you one example. Okay, continue. They will be, I hope. Yes. Okay, can you see now? Can you see?
Yes, ma'am.
Yes, okay. So what I have done here, I have selected on one job position. It was clinical biochemistry. I'm not able to show you the entire screen. Otherwise, I can show the things how when you will select that, like it was written medical, the thing, title of the job. You will click all there. It will show you the main duties, the role and responsibility, job overview, description, all jobs and responsibilities, your specific skills. What should be having? There's just specific skill means ki you should be having your SCPC registration, your qualification, and you should be able to work 24-hour, like 24 hours, because we are healthcare worker. We can't expect ki 9 to 5 jana, that's all day duty. No, we should be able to work at the night time also. So, and the qualification ho gaya, and just below the qualification you will find this thing. So this is very important thing. This is very important. Like tier 2 certificate of sponsorship. Iska matlab kya hai? The meaning of this. You want to come in the UK you want to here, and you just need to apply under that website. NHS mein apply kiya, you have applied NHS. You have to you are able to clear that interview. If you clear that interview, I'm sure you people are studying in LPU. I can guarantee you people can clear. It doesn't mean you can't clear, because I have an example of the people who have done somewhere else their bachelors, and they have applied 1000 applications and 14 interviews, and on the 14th interview he got selected. I'm talking about my friend. He got selected of the 14th interview. But you are the part of the LPU. You having a lot of people here. You can take help. You having a knowledge. Actually, basically aap us box mein, you are in that university having a knowledge, and you can clear interview. That's fine. If it's not the first interview clear, that's fine. Just try for second, third, fourth, five, six. It doesn't mean never give up. You understand? Never give up. So you just apply for that. Tier 2 sponsorship means ki with advertisement they have written here. Tier 2 sponsorship means they will provide you one letter. It will be tier 2 visa. That means after that, this letter, when you will apply, some hospitals apply from your side. Sometimes you have to apply. You understand? For the visa, you will apply, they will give you 3 years visa. This is tier 2 sponsorship means 3 years visa. You will be here in this country as a non-skilled visa. Tier 2 or the skilled workers is sponsorship letter. This is a sponsorship letter. You might have heard about Kikash, somebody in the foreign can sponsor me, can invite me. This is basically sponsorship letter, tier 2 certificate. The certificate you will get when you will clear your interview. Within 1 month, you will get your visa. Within 1 month you will get your visa. It's not impossible thing. Again bol rahi hu, again bar again I'm telling you, it's not impossible thing. It takes time, but it's possible thing. It's not a very expensive thing. You just need registration. You just need to clear interview. That's it. That's the procedure. That's not a big deal to, like I'm saying ki nahi, easy nahi hai, registration le liya. If you give up, I don't want, it's better to go take a course, or it's better to do the thing, and then no, it's possible. And I have example of the people. That's why I'm saying, if they can do, why can't you not do? I mean, you people are in the LPU. You are in the part of LPU university. You if you're not in the LPU, so that's not matter. I mean, you are in the good places also. You are placed good hospitals, good environment. You have that knowledge. That's the thing. You just go for that registration, and then job. A job you can get easily. I'm telling you, it's not a big deal. Right? So I think it's beyond the 60 minutes. So that's about just in the UK. But I can show, I'll just talk about little bit about the other things. Similarly, in America, it's ASCP. Like for that, you need to clear exam. But in SCPC, here in the UK, no exam. But for in America, ASCP, it's a certification exam. You have to clear that exam. It's kind of the registration, and you have to clear that exam. Here, this is the way how to process for that certification.
Hello.
Hanji sir.
Hey Savita, this is Jasjot speaking.
Yeah.
So
Hi.
I can proceed with the US whatever you slides over there. Just start with the last two slides. So start with them. I can explain all those time to them.
Okay.
Yeah,
So,
I was also planning to invite just for ASCP. That
I mean, if you don't mind, I mean, yeah, just
no,
go
no,
ahead and
I was planning to welcome you to give some inputs.
Yeah, thank you, sir. Okay, I'll be here, so.
Thank you.
okay.
Okay.
Thank you, Jasjot. You can talk about ASCP. You know, it's easy for you because you have already on that position. Just
Yeah,
talk about. I have shared my screen. Yeah.
I'm not turning on my camera, but I can talk just by the PPT, whatever I have knowledge about that.
just whatever input you want to give, you can give it. No
Sure. Okay, so first of all, I would like to give my own introduction. My name is Jasjot Singh, and I've done a bachelor's in medical lab technology and a master's in clinical biochemistry from lovely professional university for the year 2012 to 2017. Then in 2018, I was moved to United States of America. I mean, with my family. And let's talk about how you can get actually in the profession in the United States. I will specifically talk about the United States of America since I'm living here and I've been experienced so many things over here. And let's talk about first, like Savita has already explained the three different steps. Like first, you have to get your evaluation done for your study. Like if you are done bachelor's and master's like from LPU, that is kind of reputed university. I would say that they have a different credits credential, I mean equivalent to United States, I would say. Like in America, we have a 4 years bachelor's in clinical lab science, they call it. Like we have a medical lab technology over there, but that is the 3 years. And how you take your evaluation done, that is the main thing. I think she already explained about the World Education Services. That is I gone through already. I mean, in the 3 years ago, and when you send your documents via university, the administrator and registrar will be responsible to send the sealed documents to the agency directly. And how they will evaluate, they will calculate your credits. I mean, a number of credits you earn in India and number of credits they are currently teaching in the United States. They will compare both of them. I mean, did you gain all credits that requires to be competent in America? I mean, if your education evaluation is equivalent to United States bachelor degree in clinical lab science, then only you would be able to take international American American Society for Clinical Pathology examination over here under international category. Number one thing. And if you have only 3 years bachelor degree, the good thing is you can take a medical laboratory technician category instead of a medical laboratory scientist category under American Society for Clinical Pathology under international category. I mean, for both of them, you would be eligible. The only difference will be for grade and the position, I would say. The one is if you have a both bachelor 3 years and 2 years a master from India, that would make you equivalent like 4 years to bachelor's clinical lab science as per US equivalency, and they will give you like 30 to 33 extra credits for your graduate studies. Like yeah, that like for your master study, if you want to proceed master over here, you can continue with that. And another thing, and for a American Society for Clinical Pathology, after you get your evaluation report from World Education Services, they ASCP agency is like a regulatory body, and we have other also like here like American Medical Technologist, and another one, the major one that is worldwide is used, American Society for Clinical Pathology. And the current scenario the we have for American Society for Clinical Pathology is the most of like I'm training American people here in my hospital, so I have a lot of people those come to me, but those are studying in America. So as per my experience, we have so many people those come from international, are the Asian people from Philippines. I mean, like currently the hospital that I'm working with, we have about 70 to 80% people those migrated from Philippines. Now, just point is to think about them, how they can migrate if we cannot.
Yeah, exactly.
That is the point. I mean, you should have to think about that. And the actual point is they know the actual process, and our people our the education institute, they, I mean, not defaming about, but they are not talking much about that, how can we go inside that.
Exactly.
That make more sense. Now I would just go through shortcut in the process, how I get the exact positions here. Number one, if when you done your evaluation, after that you can go to American Society for Clinical Pathology site. You can just start your registration done, and after the registration they will ask your VAS report, the World Education Services evaluation report. You have to send the documents directly from World Education Services report from VAS to direct to the ASCP Chicago. That is the main headquarter over there. And after that, when within 40 to 45 days they will give you a reply, which exam you are eligible for. If your best report says that you have an equivalent study to US bachelor degree, they will make you eligible for a medical lab scientist exam. And if they says that you have only like study that is only equivalent to US associate degree, like we have only 3 years bachelor degree over there in India, so they will only make you have an equal to associate in medical lab technician. That is will. And after that, ASCP agency will decide that which exam you are eligible for. Okay, so within 40 to 45 days you have to, I mean, choose your center for the exam. Like in India, I know that they have 2 to 3 centers, like one in the New Delhi, another one in the Bangalore, and the third one is in Mumbai. I think so, but I think there are 3 to 5 centers over there, so you can take your exam over there. And after you are done with your ASCP, and you can start looking for LinkedIn for sure. Like if I show my LinkedIn account, if I show my inbox site, on daily basis I get 3 to 4 offers on daily basis now, because currently I'm already in profession, and I mean I'm earning well. I'm in United States, I know well. And I did not study even a single letter of education in the America. I already study in India only,
Yes.
not in America. That is the point, that how you go through the process and how you dealing actually with the process. And that is, I mean, how your professional attitude says about you. That is the main attitude. And after you take your exam, you have a like registration fees for ASCP, like that is $200, I would say. Yeah, $200. How much is that cost in India? That is about 15,000 or 14,000, not more than that. And after getting ASCP exam, if there would be like 100 questions, the actual marking is like based on the type of question. Some are lengthy, some having like panels over there, and some has a 10 marking, some depends on that. And it is out of 950. If you get an out of 950, you are getting 400, you are pass. That is a good condition over there, and you will be SCP certified. And I would tell you about the good point for ASCP registration. There are about so many countries, like in Dubai. If you cannot afford the big countries, like I'm in straightforward saying here, if you cannot afford the big countries, just try for UAE, any lab in the Dubai. I know so many people, those are friends mine, those are working, and they are earning about 90,000, more than 1 lakh per month in Dubai right now. And they just show their registration as an ASCP over there. Let me tell you the exact process how that works. I mean, this is the common process for Philippines and for Indian people too. I mean, the only thing how you go through with that process. So what they do, just apply for jobs in Dubai. If you are not getting in the first attempt in the America, I'm not saying that you don't need to apply in America. You should apply direct, like for the bigger employers in America. Like I'm in the OSF. I used to work in OSF. Like I resigned from there last month because I got a good agencies to work with the freelancer scientist. So you can find for a big employer, those are ready to sponsor the people from different countries. And if I talk about the shortage, we are about 70 to 80% healthcare professional shortage currently going on in the United States of America. That
Similar.
is the,
Okay.
yeah, that I mean, that is the current scenario. That is why they are allowing the people to work in a lab from a different, other than the clinical lab science profession. If you have any other biological study in the United States, you can apply under non-traditional category technologist position, and you will work with the same, but there might be a little bit pay difference, and the designation will be non-traditional technologist. I mean, this is the current scenario. They are hiring people. Either you have just studied biology, you can apply for the non-traditional position in the lab, and they will train you in a specific department, like whichever they need. And currently, I would say, like the current place where I'm working, working in the Unity Point Health now, and we are about 60% shortage. I mean, you can imagine we are 60% with the shortage of people. I mean, they are not getting exact people. And the current place where I'm working, it's only me Indian, and about 90% are Philippine tax.
Yeah.
Those are being sponsored by another countries.
Yes.
So so one of the person asked me when Sharma is his ASCP is difficult to crack. I just saw the question. It is not that difficult. If you have studied well studies in India, I mean, you have a good grasp on your the practical knowledge. You can easily crack that. You can easily. I personally can guide you. Anyone can contact me. Anyone just search me on LinkedIn, just your thing. Just contact me. I'm free. I'm free for all these things because I work. I used to work like 7 to 8 hours only per day, and I sleep about 12 to 13 hours. I mean, honestly, I'm telling that's
Yeah,
like,
just sorry to interrupt you. That's the
yeah,
best thing we're talking about. If somebody is already in the same field who is like having a good qualification and the same job,
yeah.
need to work for extra hours. That's the best thing.
Yeah, I don't work extra. I don't work extra.
Yeah,
I mean, even they are working me, paying me double. I don't work even extra. They ask
exactly.
me to do. You know. But now come to the point. I mean, I would just go with the whatever I have to wrap up all these things. After getting ASAP certification, if you are not getting direct job in the United States of America, just try to first thing you have crack ASAP exam. Just try to find the big employer in the United States. Like in California, they have a Kaiser Permanent, but those states they ask along with excuse me along with ASCP, they will ask you about the uh, state license also, like for California state license. So don't go for those states directly. Just look for the states those are having only requirement just for ASCP. And I'm pretty sure that throughout the nation we are short staffed now, and they are getting people from from other profession also. If you have a biology, like I already told before, if you have a biology, you can apply for the hospital job in the lab. And after going for ASCP job, just try to catch the big employer. Those have really 14 to 15 hospitals minimum in US, and just try to contact them and keep applying for their jobs. And one day, I mean, I can personally recommend the person who is really willing to do that. I can personally recommend, but I really need a person who is really want to do.
Yeah.
Okay, I mean, yeah, that is what I can do for the favor for other people. The after if not the second option, what I'm saying now, the thing when they take your interview, when you're applying for US interview, they need some standard. Like Savita has already talked to you about the standards. There is a huge difference when you're working in India and when you're working in abroad. There is a huge difference, and they will mostly talk about the standard. So if we are not directly standardized to work like as per the US metering requirements, just apply for Dubai or the short countries like Saudi Arabia. They will pay you. I mean, as compared to India, you will work less, but you can get paid like for sure 90,000 to more than 1 lakh per month. I'm pretty sure that because most of the Filipino tax, like I have a 90% Filipino. They most of them 70%. They sponsored them from Saudi Arabia. They work there like for 3 to 4 years. Then after they apply for US, they match their standard because most of the UAE sites they have a standard as per the US equivalency. I have seen that. Okay. Another thing, and like in Dubai and other countries, they have their own examination DHS. But if you have a ASCP exam, they will give you first a preference rather than their own exam. Does that make sense? I mean, they are like Dubai, they have their DHS. That is quite difficult to crack than the ASCP. ASCP is, I would say, easier than DHS for Dubai. Just go for Dubai and then do 2 to 3 year works over there. You can easily get job in any country after that because you can meet those standards. That is what I would like to say. And after you get in US, like they will give you a 3 years current visa. They will sponsor you everything. Like there are big employee, like in Mayo Clinic, we have a OSF. There are so many other. I cannot mention aloud like right now, but there are so many big employer in the hospital section, like in the healthcare. You can just look for their jobs, and there are always 50 to 60 job, only the lab jobs I'm talking in each site. If you start searching, okay, and you can keep applying over there and get certified. After that, apply over there, and yeah, if you are cracking the interview, they will take care of everything for you. You will get your visa, and after that, after 3 years, if they like your work, they can apply for your permanent residency. That
Yeah.
is the this is the current scenario. I've seen so many people; those are getting now in the person. I am already a resident over here, but I have friends over from Asian countries, like from Philippines and the other countries. They are now under process. They already spent 3 years at the hospital, and they are now under process for their permanent residency in the United States. But they are getting pay equally, and they are getting sponsorship from the hospital side. That is a good point. And I'm telling again and again, if you are willing to do ASCP, you can easily do that. It is just out of 850, you have to do a minimum 400 marks. If you get 400, you are pass. That is not a big deal. I have not said you cannot get a 50% at least, right? Like when I became an exam, I just did a preparation like for a 1 month only. And after that, I took my exam and I clear in my first attempt. The exam duration is 2.5 months, half hour. And I remember that I was passed within 20 to 25 minutes. And I got about 700 scores on it. If you are getting 400, I mean, that is pretty much good. And the cost for evaluation, for your Ielts, and for your registration, that would be not more than 40,000 Indian currency. And after that, if you are getting sponsorship by country, they will take care of everything. They will pay
Exactly.
for your visa screening, they will pay for your ticket, they will pay for your residency, they will pay for your accommodation, everything. They will take care of everything. So this is my perspective. That is my experience. And the another point I would like to add over here. if you are overqualified, like I have get so many inquiries from our LPU group. There are PhD candidates over there. They usually ask me that how can we get in over there. I am straightforward telling you, if you apply for their job, they will disqualify you completely because you are overqualified that time. Just
Yeah.
be equivalent to qualified, take your experience, then only you can get in the lab exactly. And if you have a PhD, I can go with another path. You can apply for the postdoc over here. You have a good research experience in India. Just try to get postdoc because I know so many doctors. I have had one doctor from Guru Nanak Dev University, Amritsar, and he's done PhD from there in biochemistry. And the biggest hospital employer in the United States is the Mayo Clinic, and he's a lab director for biochemistry over there, Dr. Ravinder J. Singh. And he is his postdoctorate and he's a postdoc fellowship from in America. And another example I can take for a doctor, I was just talking 2 hours ago with him, and he's from a PGI MER. I know so many doctors those move from there. They just did a PhD from there. They moved from after that they got your fellowship and all this thing. I don't know what is the I mean the what are the higher education says much about, because I tried one time and I got failed. I'm honestly telling you, because of I didn't have a research experience that time. But I'm satisfied with my own profession, and I am currently working as a lead position and a leading and leading and training the American people. That is enough. And if you have a PhD, just go for a research and look for a biomedical schools in United States. They really need you. They really need you. I have seen
Yes,
so.
Jyot.
Yes, sir. Go ahead.
When you are applying for jobs, if you have done 4-year BSc or 3-year BSc, is it differentiate means in the selection process, or is
No,
it
it
same?
does not. Yeah. When you apply for job, there would be two different categories. One would be the medical lab technician, and then another one will be either medical technologist, or it would be medical lab scientist or clinical lab scientist. These three designations are almost same. Okay, clinical lab tech, whatever is the technician, that will be based on your associate degree. Like as per the associate, it will be 3 years in your Indian at bachelor degree, okay? But
Yes.
as per the ASCP, if you are taking a exam on the basis of 3-year degree, you would be only eligible for a technician exam, not for a scientist grade. If you have like a master, you
Jasjot,
have a yes, sir. Go ahead.
Jasjot, hello, how are you?
I'm all right. How are you doing,
Jasjot,
bud?
yes, Jasjot, I am having one question. Suppose if a student is BSc MLT 3 years
Uh
plus
huh.
2 years MSc, the total,
Okay.
he got 5 years.
Yeah,
So
he got
I
yeah
think
yeah. So
he will get advantage after the post graduation, because you five
Yeah.
I think 5 years are too much to get, I think, scientist, position of the
no.
scientist.
I mean, no. It's not too much. It's like me. I did a bachelor's and master from from LPU. So when I get evaluated from there, it was like they made my education 4 years equivalent to
Exactly.
US graduate program. They add about 134 credits to US bachelor degree, and after that the remaining credits they gave me for a graduate study. If I go for a master's in US, so I would just complete only 1 year instead of two. Does it make sense? So
So over
they
here
gave me,
MSc help out now, as
yeah,
compared to
Exactly.
that will
3 year
definitely
BSc.
help out. Yeah, that will
This is
definitely
my
help out.
question.
Yeah,
Actually,
that will
this is my
definitely help
question.
out.
Suppose
Yeah,
if I
and
go there after the if I go there after the completion of 3 year BSc, so
uh-huh,
comparatively over here, if I complete 5 years, so it
uh-huh.
would help us in America or
Yeah,
wherever in abroad.
always, and because I get so many inquiries from not only from LPU, from other institutes too, and they usually ask me, can we come after bachelor's? I always said, yeah, you can, of course you can come, but the thing is, you could be only limited. But with
Hmm.
the
You would be
master,
restricted over there.
I always encourage people to go for the masters in the country you are being right
Yes.
now. I
Yes.
always encourage people over there, and I'm not. I mean, I honestly, from my personal experience, I'm not encouraging people to go for a LPU direct. Go for the research institution.
Yes,
Not
after the
only,
MSc also.
yeah. After bachelor, go for the research if you really want to go for a researcher in like in the biomedical. I mean, go get a grasp on the single projects and take as much as project you can. That is the drawback, sir. I have that is that because of that I was not able to get in PhD in US, and I tried only one time. I mean, I can easily go, but I didn't try a lot. I don't want to spend that much time now, and I'm already well settled. But if you have a
So,
master, that is really worth over here. If you have a master from here,
so yeah, I am very happy today because
yeah,
today my two alumni, stars are over here. So I am also just very happy along with the, Savita. You also join and you also participate in this discussion, and you
okay,
both of Savita also focus on UK as well as Canada, and you are already working in USA, so you clear all the doubts of the students about the USA. I think it and
yeah.
you
I mean,
both of
it is
yes,
not like that. I can guide whoever. I mean, willing to do from heart. I mean, I really need students who really wants to do, because I've been so many tough times throughout in India, but now I know the worth of mine. Okay, so like. I would really like to encourage and push up the students those really wants to do, so
Exactly.
yes,
they can
wonderful.
contact me via LinkedIn. They
Just
can
Jyot,
research
you
me
can
over
share your
there.
number on chat also,
No.
right?
I cannot share my personal number, but
Okay.
they can contact me via
Social,
LinkedIn.
you can share your LinkedIn or whatever, any any
My
link.
LinkedIn is over there. I can share in the group.
Yes,
Okay, they can
yes,
contact me. They can message me anytime, and I promise that I will reply them within. I mean, within
good.
so as soon as possible, because most
Thank
of the
you.
time I used
Uh,
to be free in America. That
okay.
is what I know. Yeah,
Thank
The
you,
best.
Jojo. Thank you so much.
yeah. I mean,
Okay,
this is what I
Savita.
can do. I can guide from initial to end. Though only the student those really wants to do.
Good, good. Thank you, sir. Just Jyot. Thank you so much.
Yeah.
Now, after this, Jyot, now I request to Savita. Now, please, you compile your presentation. So after you compilation. So any query from the student we will handle. So over to Savita, please.
Okay, sir. So, ASCP, I don't need to talk about. The people, just Joe has already explained very well.
Yes, I think it is
So,
already
yes,
completed by just
yes,
Jyot.
sir. So, you can see the equivalency over here. That exam he talked. So, Canada is also similar. In the Canada, you
Yeah,
need.
I can talk about Canada too. Like for Canada, there are similar category, but the examination pattern is quite different. They have a
MLS.
MLS over there, and MLT over there. I mean, under that side, you have to look for the international category. Land under international category, you can find almost the similar pattern. They will ask you your evaluation. They will
It's
ask your
almost
experience. It is almost same. I have seen so many people, and I know there are so many people. Those are known to me. Those are working over there. I know so many people.
you can see here the example of giving. This is my qualification of Bachelor's of Medical Laboratory Sciences, and I want to tell you one thing that I have not done 3 years. I have done 2 years, but I have diploma, but I have not sent them diploma. Again, I'm explaining the thing. I have done diploma and 2 years BSc I have done from Lovely Professional University. You can see my education assess here. It's equivalent to bachelor's degree 3 years in Canada. Means the people who are doing BSc in LPU, their degree is 3 years equivalence in Canada. You understand my point? But I have 2 years degree. Still, it is 3 years equivalency. So that's the point I'm talking here. Equivalency is very important. It doesn't matter you are doing lateral entry, you are doing 3 years, 4 years, 5 years. I have an example of Nigeria. They are doing 5 years, but they still are equivalent is it's 4 year. You understand? So 2 years we had, so that's also equal to 3 years in Canada, as well as it is also equivalent uh, in USA. It's also 3 years degree. So that's the just so as I already explained that he has a master's that's equivalent to master's as well as bachelor's 4 years. That's the difference here. So degree is equivalent. That's not a problem. This is the Canadian exam. You have to apply for exam in advance. You have to plan the things in advance. चाहे आप कहीं भी जा रहे हो, whether you are going to America, Canada, UK, you have to plan in advance. You have to book the examination. You have to pay. You have to. I mean, you should be organized for that. For a career, you should be organized. Proper organization is very important. Proper management is very important. This is before early deadline fee, before like early or after. So this the fee is mentioned here. It's a website. You can check on the website. So different are medical assistant are different, and non-resident of Canada or resident of Canada. It's a different, huge difference is there. So, but you can still go for Canada with examination. If you have exam, I mean, you have this certification, CSMLS, nobody can stop you to apply there. Nobody can say you can't apply for PR, you can't get PR. Why you are wasting money to just take a course in Canada, 2-3 saal course? Yeah, after 2 or 3 years, again, you are doing this examination. Again, like the people who are already there, I know many people are doing this and they are trying for this examination. So it's better to do from your country and then move there.
Okay.
So that's the overall. Thank you so much for this.
Okay. I want to add one more thing over here. I'm just reading the questions over here. So the first question is, sir, is the exam is it too difficult to crack? Venuka Sharma, no, it is not too difficult. I already explained that you just need only 50 to 55% to pass. And that Devender as Sawat, I don't know how to explain the name exactly. I'm sorry for that. Sir, can you please mention those standards? I mean, standard does not mean that it's like a different regulatory body. Like we are following the standard under the College of American Pathology. Okay, College of American Pathology. We have OSHA, we have ERCOLA, and in the India we have NABL, National Accreditation Board of Calibration and Testing Laboratory. So those standards are almost similar, but the way to perform the testing is completely different. Like in the work, like in the microbiology scientist, when I work over there, we have a robotic technology. So you have to search for those technology before you give in an interview. Okay. These kind of standards, that how the internationally people actually working, that is the meaning. And we are not working like the most of the doctor used to do for reporting, but here we are, the scientists are responsible to do starting from to till end reporting. The only thing we just send is for the doctor, we take opinion for doctor if it is only the critical. Otherwise we will be responsible to take the all the tail end of the reporting for any kind of, either it is a micro, either it is a hematology, either it is a biochemistry, either it is a immuno, I mean anything. You have to do reporting as you are on. So you can imagine that how much standard you need your own. Does that make sense? I hope you understand my point of view. And after that, sir, what is the band score for IELTS required for USA? I think it is 6.5 to 7. I mean, you just need to cross check on the internet. I mean, whatever is over there. But if instead of IELTS, you can go with the TOEFL, that would be much better. In the TOEFL, I think you can just need a 80 to 90. But if you are comfortable with IELTS, you can go with the 6.5 to 7. And the last question, Priya Giri. Sir, 2015 to 2018, I completed my BSc Biochemistry, and currently I'm going to complete my MSc Medical Biochemistry. Then after, how can I get my medical laboratory jobs? So here is one thing I would say. Just if you really want to go for the America, like if you really want to go in the healthcare laboratory, like in the diagnostic lab, just look for the specialist exam in the chemistry. There is a ASCP I category, international category for MLS under CC. That would be over there. I can share the whole file for the international category in the our LPU group. I can share like within 5 to 10 minutes. You can go through that file. If you have any question, you can just direct me in the group, or you can just message me personally. And I would personally request to everyone, don't think about that if you clear those exams and you would be able to get the job. Do not make your mindset like that. Just start it from initial where you are working right now. Just try to get job after your, as soon as possible you get graduated from university. Try to get job in India in a reputed hospital, so that you can get at least that touch base that how exactly hospitals are working, what is the exact base going on in the lab. It is not training. I know what we are doing exactly during the training period. I know because I already gone through a training period, and I know how much they teach. But the training difference in America and in India, that is 100% different. Here we have a 1 year training, and we know how we are dating our kid over here. They are 8 hours working with us. They are working 4 hours as a lab assistant in our lab. Then after they are doing their lab rotation for 8 hours per day. That means they are spending about 12 hours in the lab. So that the my point of view is saying is, just try to get your profession like in the technical along with your education. That is the most important task. It is not important that you get a much GPA and all. It doesn't make sense. If you are getting 7.5, that is enough. But how you are a practical says, that is much important. So my
Any
point
job,
of view to, yes sir.
any job experience is compulsory.
Yeah, this is what I'm saying. If you are in the first year of your education, I know in the LPU we have a rotation in the lab every like for 3 hour or 2 hour, whatever is over there. I don't know what is the current curriculum you have, but
Yes, same thing.
start your job like you have a 2 to 3 months vacation in between from July to August. Just to find a local job in the, I mean, in your area, just to be a volunteer over there instead of sitting at your home. Just
As
be
much as
volunteer over
experience
there.
you will have, it will be better, right? To get a
Yes,
job.
sir. That is what I'm saying. So, I mean, and when you get a graduate from your university, like you get your bachelor in medical lab technology, and try to get your training from a good hospital, that is
And
really name and worth. Like
normally,
the
your because
like the SRL Gurgaon, I think that is following the standard for a CAP. And just try to search the CAP, College of American Pathologists, and search the your labs and the hospitals. Those are following the standard for CAP.
yeah,
You will find a lot.
yeah. Normally,
I
whatever
mean
experience you are getting, whatever
yeah,
experience
this
you are getting, or whatever education you are getting, it is not going, never going to be wasted. Somewhere you can use it.
this is what you're saying. But the experience you are gaining from the basic to advancement, that is much more helpful to you guys
Yes.
in your interview process, because in the interview they don't ask you where you want to
Uh,
move, whatever they teach in the soft skill, that is a completely different. When you give a technical interview, that is a completely different, I would say that. I mean that when I gave my second interview, I've been so many interview, I mean while in the US, they will directly ask what instrument you use over there, and
obviously, obviously.
if you get this situation, how will you handle? If you get this, you got a lot of specimen, what do you do? So they will ask you always about the situational basis questions.
Yeah.
And I mean the situations you can only explain if you have faced them personally.
Yeah.
Does that make sense?
Yeah, what we
Yeah.
can do, we can have a series of lectures. Like one day we will talk about on a scholarship. One day we will talk about different type of exams. That can be planned because in 1 hour or 1.5 hour or 2 hours, you cannot cover everything.
Everything right.
Yeah. Yeah, that is fine. Yeah, and that is really nice. But my point of view to saying is just to get a good training, good knowledge, good basic
Yes.
before you get in this profession, because this is a really a noble profession, and we respect this one. It is not about you get your degree and you are
Obviously,
just earning.
see,
It's not
no one
about
is
that.
going to pay you just to if you are going to have a theoretical knowledge.
Yeah, it
These
is
are the
not
practical.
about that.
These
And
are the
you get
practical.
your journey. If you are doing it just only for money, I mean, it is not worth. I
Yes.
mean,
Uh,
really, honestly,
yeah.
I'm telling. And
Yeah.
if you are skillful in this profession, people will be behind you. They will ask you how much you need. And this
Yes.
is my current situation.
Yeah. These are practical based courses, and as much as
Yes,
expert,
sir.
as much
Yes,
as
yes.
experience you
And
are having, it will go.
that is the current situation. Every lab manager will ask you how will you handle this situation, because they already have 20 to 25. I'm working with the people those have a 45 to 46 year of experience. One of my lead tech, those is this she's working with me. She's going to retire this coming 30th of June.
Hmm.
She is retiring from the hospital after 46 years. So, I mean, we can easily imagine the level of their
Yes, obviously.
talking, from this situation, because those they have already dealt the situation, and we are just like newcomers in this profession.
Obviously, and if anyone is
And
going to pay you, obviously, and they are having lot of options, so they will select a best one.
yes, sir, and that I mean, everybody wants to select the cream over the milk,
Obviously, yes.
not under the buttermilk. That is the current scenario. I
Yeah.
mean, that is the current situation, and I already told you the situation worldwide. We are already short staffed. They are hiring people from internationally. I mean, that is for sure. I mean, the only thing people in India, they are just caring. I mean, if we spend in this money, will that be worth? Like if
Yes.
I'm paying for
No,
ASEP, like yeah,
Jyot, that sorry to interrupt. The thing is
yeah,
that people are ready, especially from Punjab. I have seen people here. They are working. They're having a good qualification, but they still are working somewhere else. That's not
yeah. That's
possible.
yeah. I mean
And they are
that
wasting money. They are wasting money
they
to
are
come
wasting
here,
money too. They are
selecting
wasting
courses
their
which is
worth too. They are
relevant.
worth too. Yeah, I
Yeah.
would yeah.
So
But
that's
I mean, I cannot make a comment on that opinion. I mean, that might be their own opinion. Somebody wants to go in
no.
the
I have
healthcare.
seen people.
Yeah,
I have seen
healthcare. I mean,
people.
somebody wants to go in the healthcare administration. So most of them they take course in Canada like healthcare safety and
But
administration.
that's
That is
that's
the
not their
1 year.
choice.
Yeah,
That's their.
that
I
is
mean,
their
people
choice. So we cannot
misguided.
comment directly on that. But I would directly say that just stick to your own profession. If you have spent 3 to 5 years, just make it worth.
Yeah.
You
Yes,
know,
yes,
and
exactly.
I'm pretty sure that it is like if you are spending your 1 year or 5 year, I mean, each and every second of your work will count, and that is worth to this profession. And this is very. I already told you, we have to respect this profession. We are dealing with the people health. Any mistake, I mean, you can
Yeah.
interrupt the report from one place to another. I mean, it is not about you open your laboratory. I know the Indian standard. That is the quite worst one, I would say, because I'm currently working in the standard, but they have to have one regulatory body over there. Those can, and I have seen the people, those just came out fresher from the university and they started to open their own lab. I mean, they should have some standard over there so that they can regulate the people. We have this much standard to open,
Hmm.
I'm not blaming to someone profession. It is fine. You are doing. I mean, it's well. You are earning well. That's fine. But we should. I mean, yeah. I feel like from heart. That's what I
No,
would say.
it's fine.
Yeah. Yeah. Sir.
Yeah.
I'm sorry if it has hurt anyone,
No,
but
it's
that's
fine.
my point of view. Yes,
It's
sir.
okay.
Yeah. Yeah. I mean, that's grand my point of view.
Yes,
No
wonderful.
problem. We will
And
come with another lecture
one point,
sometime.
the last point. I'm sorry, I'm extending this one. And one last point, just try to get in the organization that is really reputed,
Yeah.
where you can specimen and where you can exactly the technical situations. You know, where you can get the big instruments to work on. That is really important. and the technology principle for instrument, that is almost same. I mean, if you are working coulter, that is almost same. If you are working laminations, I mean, instrument may be different, principle is same. But just try to get the catch the big hospital where you can get at least, I mean, 500 to 600 specimen. You can understand your work worth, and do not waste your time while you are in training. Do not. This is my personal opinion. Because when I was in Apollo, I used to spend like, I used to have 8 hours over there, and I stick over there till 8 p.m. You can ask any technician over there in Apollo, and same what
So
was
because of
with the
hard
quality.
work, because of
Yes,
hard
sir.
work, you
Yes,
are
sir.
there.
Yeah.
Yeah,
I mean,
this is
you
the
have to.
key. This is the key
This is
of the
that
success,
is the
because
key.
you
Yeah,
people are
that is
there
the
because
yeah
of
that
your
is the
hard
on
work,
that
sincerity.
that is the
That
honest
this is the result of
honest
your hard work.
that is the honest opinion I am giving to you, my juniors. Either they are seniors, they are working well. That is my personal opinion, and that is really need now this profession. I
Yes,
don't know.
wonderful.
Yeah. Yes, sir. This is my. That
So
is all
just
from
Jyot
my side.
and
If
Savita,
anybody, yeah,
wonderful.
if anybody
It
need
was
my help, they can
yes,
just
it was
contact me.
very good discussion from both of you, and I
Uh-huh.
hope student learn so much, and I hope you people now open a new pathway for them. The pathway to abroad, I think so, right? So it was a wonderful discussion. Savita Bhartwaj, thank you so much, and along with Savita also, just joined and given wonderful input to our student. I think now students are explored so much, and they got exact idea what should be done in the future,
So,
because I think
so
they, and definitely in future again we will call you, and we will discuss all these things in length also, right? So how
yeah.
we can motivate our students, and they are having dreams, and how they their dreams become true. So definitely to make their dreams true, we need guidance. We have to guide them as a senior, because yes, definitely everyone is having dream, but yes, we can fulfill our dream with sincerity and hard work, right? So with this again, I thanks from my bottom of heart to Savita as well as Jasjot, and I proud of you, and you are working hard over there. Definitely, with the passage of the time, you will get more success over there, and will
Hmm.
establish over there. Whenever with the passage of time, you will become senior over there. So again, thank you so much,
So
and thank
here
you
are
all of you.
so do sir, do I need to give answer for the question they are asking, or they can just contact me via
Yeah, why not?
LinkedIn?
I will plan one more lecture, just Jyot, and especially from you also again, right? So
Okay.
I, because
Okay.
right now the student wanted actually the lecture from the alumni who are already working in abroad, because right now it's a time students wanted to go abroad and settle over there, but actually they don't know what is the exact pathway, right?
Uh-huh.
So so I and definitely this is
So
the first
let
episode.
me let
This is the
let me
first
let me short
episode.
let me shortcut all these answers in they are asking. There are 5 to 6 questions only. Uh, sir, can I?
Within 2-3 minutes, because already it
Yeah.
is more
Within
than
2 minutes. So it's
yes,
a
it's more than
pre-agree,
two
sir.
hours.
I already give this answer, ma'am. 2 years experience in required to get job in USA. Yeah, that is enough, man. And make sure it is from a good hospital, and that is the accredited under the Indian NABL and all. You are following that standard. Any experience in required? Yes, sir. The experience is required for must. That is for sure. For US, yes, the experience is everywhere. Nandri Sharma, is there any study gap between UG and PG? They can explain. No, it doesn't matter. If you have I mean, equivalency for US or whatever the equivalence agency, you can apply anything. Sir, in how many attempts? I think there are 3 to 5 attempts. 3 attempts, I think, for ASCP you can apply for. So many visa advisor says you should go with the many study visa. Don't even consult with any visa advisor. I can guide you. I can advise you anytime. Just consult with me. Just you have to fill up the all paperwork by yourself. Why you I mean give it to the visa advisor? Why you pay them if you are educated enough to do all paperwork by yourself? Okay, so it is so easy, just a simple process. Only thing you have to understand the process. I can guide you on this. Follow me on contact me on LinkedIn. Thank you everyone. Thank you so much. Mercy Marlene. Thank you. No problem at all. Thank you so much.
So
It's helpful
thank you,
and
beta.
complete.
Thank you so
Okay.
much.
Okay.
So thank you, Savita. If you are having any
Yeah,
point,
that is all.
if you would like to add, please at the end, Savita, you would also add if any conclude this presentation, please.
Yeah.
Sir, okay. So there are lots of questions that people have asked. I'm not able to give you answer.
I think I already answered all the questions.
Yeah. So there is like, see, it's for the USA it's a different, but for the
Yeah.
UK it's
UK
different.
might be different. Yeah.
For the UK, you don't need to clear any examination. You do not need to go for examination. You have already doing degree. You have a degree. There are lots of questions are asked. Any exam, no exam for SCPC. You should be eligible for that. If you're having experience at least 2 years from good hospital, that's really matters to crack the interview. That's for interview I'm talking. Interview you have to clear. And for you people, it's easy to clear interview. I would not say it's difficult. It's very easy. If you're not clear in first attempt, that's fine. You can go for next attempt. Then
Yeah.
next.
This is what I said. That keep applying.
So that's all from my
Yeah.
side. You're having my mail ID, so you can connect on me there. LinkedIn, anywhere you have already connected with me. The people are almost, I can see the names, they are connected with me on social media as well. So they can ask anytime. I don't have
I
any
have
Okay.
fear.
I have shared a LinkedIn profile for both of you.
Okay. Thank you, sir.
Thank you, sir. Thank you, Gurinder, sir, for giving this opportunity to share our experience with our.
Thank you, Savita, and thank you, Jasjot.
Yeah. No problem, sir. Yep. Sure.
Thank you, sir.
Thank you. Goodbye.
Thank you, everyone.
Bye.